I'm Dr. Corey Cutler, and I am the director of the stem cell transplantation program at the Dana-Farber Cancer Institute in Boston, Massachusetts. I also had the privilege of being the principal investigator of the ROCKstar clinical trial, a study that demonstrated a very impressive response rate in steroid-refractory chronic graft-versus-host disease of approximately 70%. What we've learned from ROCKstar and what is forthcoming in the literature is a long-term analysis ROCKstar study that demonstrates that responses on Belumosudil are actually quite durable, with very few adverse events occurring beyond the first year of therapy, and a median duration of response now at approximately 18 months. Very important in terms of long-term outcomes from the ROCKstar study is that a large proportion of patients were able to discontinue all immune suppression. The time to next immunosuppressive therapy has actually not been reached, the median, for the 200 milligram twice a day dose. And we're approaching 2 years for the 100 milligrams once a day. Now, these are data that we gathered in a very rigorous clinical trial setting, but in fact, we are learning in the real world that these responses very much mirror what we are seeing. There are now several case series from investigators throughout the globe that are demonstrating overall response rates very similar to what we saw in the ROCKstar. And this is really quite important because it tells us that the results of ROCKstar don't only apply to that very specific ROCKstar patient population, but apply to patients in the real world. We're learning more and more about the efficacy of Belumosudil in the long term. There's very impressive evidence that demonstrates it can not only halt the changes associated with bronchiolitis obliterans, but in fact can result in reversal of the airflow obstruction that we see in patients with disease. Additionally, we're learning from studies that have done tissue biopsy on patients with active sclerosis. We can actually see reversal of sclerosis at the microscopic tissue level, staining specifically for things like collagen in the tissue, such as in the oral mucosa. And we are now able to demonstrate there is reduction of collagen deposition treated actively with Belumosudil. We're learning more about which patients might benefit from Belumosudil. And in one study, the original phase 1 dose escalation, we learned that patients that have early increases in regulatory T cells were those that were most likely to benefit, which speaks both to the mechanism of action of the compound, but also speaks to the fact that we might have an active biomarker to determine which patient. Looking forward, I think we have to find a marker that will determine which patient is most appropriate to receive Belumosudil in the steroid-refractory setting. It is approved in the third line in North America, although, of course, some patients might have biologic characteristics that would make it an optimal drug either earlier or perhaps later in lines of therapy. And then most important, I think, is the fact we are nearly done accruing to a trial that will evaluate the role of Belumosudil in the upfront setting. That is the rock and roll study that is evaluating Belumosudil with steroids versus steroids alone for newly diagnosed chronic graft-versus-host. So clearly a very active compound, and clearly a compound where we have more to learn. And I look forward to sharing further results with you in the future.